January 15th, Inauguration Day, an executive order making masks optional for students in Virginia's public K-12 schools was issued by Governor Youngkin. In light of this executive order and in the interest of full transparency, it's important for us to be aware of the recommendations of Virginia medical experts and other health professionals. Attached documents summarize these recommendations. The Virginia chapter of the American Academy of Pediatrics strongly recommends that children continue to wear masks in school while rates of COVID-19 infection remain high. In addition, a letter from the health directors of Fairfax, Loudoun, Prince William, and Arlington counties and the city of Alexandria firmly endorses multiple mitigation measures, including vaccinations, masking, physical distancing, testing, and quarantine, because, as they quote say, no one single measure is perfect. They also, however, stress the importance of maintaining universal indoor masking in our schools. These practices are crucial if we want to continue to keep schools open and minimize staff and student absenteeism. Here in Fairfax County, we're committed to keeping schools open and have spent 2 long years slowing the spread of COVID-19 to facilitate just that. We followed the science and our trusted health professionals. As of January 20th, proud to say that more than 80% of all Fairfax County residents have received at least 1 vaccine dose, and there are more than 300 vaccination sites across our county. Our school-age kids who have received at least 1 vaccine dose include 46.7% of children ages 5 to 11 years old, 90.1% of those 12 to 15, and 94.6% of those 16 to 17 years old. In addition, through targeted outreach and mitigation efforts, we're closing the gap that existed early in the pandemic, wherein the county's Hispanic and Black populations experience higher rates of COVID-19 infection than other racial and ethnic groups in Fairfax County. Thanks to these efforts so far in the 2021 to 22 school year, Fairfax County Public Schools has not had to close a single school due to COVID-19. Following a 1.5 years of virtual learning, winter weather complications, and considering nationwide staffing shortages, we have enough challenges to overcome. As an elected body, it is our duty and that of the Fairfax County School Board to prioritize health and safety to the best of our abilities, including to ensure the best education for our students. Furthermore, it is in the board's interest that our economy continues to thrive. For that to happen, our schools and businesses need to be able to stay open. There is no evidence to support changing our approach now. Our layered mitigation strategy has resulted in a low rate of in-school transmission of 1.1% in Fairfax County, according to an October 2021 report, and FCPS reported 1,300 cases of COVID-19 in January alone. All of our efforts should be focused on reversing this trend. Additionally, we're in the midst of a 30-day state of emergency order issued to help address the major strain on Virginia hospitals caused by Omicron. It is inconceivable that we would lift masking requirements while we remain in this state of emergency, which was supported by Governor Youngkin and in fact reissued less than a week ago by Governor Youngkin. Beyond all of these considerations, it is unclear that the governor has the authority to lift masking requirements under state law. As a result, FCPS is leading a lawsuit of 7 school districts to reinforce their local authority. Among other things, Senate Bill 1303, passed during the 2021 session of the General Assembly, states, and I quote, "For the purposes of this act, each school board shall provide such in-person instruction in a manner in which it adheres to the maximum extent practicable to any currently applicable mitigation strategies for early childhood care and education programs and elementary and secondary schools to reduce the transmission of COVID-19 that have been provided by the Federal Centers for Disease Control and Prevention," end quote. The CDC guidance for COVID-19 prevention in K through 12 states, and I quote, "The CDC recommends universal indoor masking by all students ages 2 and older, staff, teachers, and visitors to K through 12 schools, regardless of vaccination status," end quote. We all want to be able to return to normal as soon as possible. We would love to be able to take our masks off and no longer be concerned about the spread of COVID-19. It is not a question of being pro or anti-masks. As someone with 2 kids in our school system myself, I look forward to the day that our schools return to normal, but not until it is safe to do so. Instead of making political decisions, the governor's team should establish metrics to inform school districts who are already struggling with so many things when it will be safe to lift mask mandates. Therefore, I move the following items. First, I move to support our Fairfax County School Board and Superintendent in their plan to continue to requiring masking of students, teachers, and staff at all FCPS facilities at this critical time. Second, I move that the board approve the attached letter to the governor encouraging him to develop metrics in coordination with local health directors and school districts in cooperation to achieve our mutual goal of eliminating masks when it is safe to do so. Third, I move that our legislative team update the board on any legislation that seeks to alter Senate Bill 1303 or current masking requirements in schools, including the following legislation that's been filed in the General Assembly: HB 514, HB 1036, and HB 1038. And finally, and fourth, I move that the Office of Public Affairs continue to work with the Northern Virginia Regional Commission on communicating the importance of a layered mitigation approach to COVID-19, including the importance of booster shots and wearing masks while community transmission remains high.
You've heard the series of motions seconded by Supervisor Lusk. Is there discussion on the motions? Mr. Chairman.
I'll try to be brief, Madam Vice Chairman. I thank my colleagues for their indulgence and support on this. This is so important on so many levels. I have attached the American Academy of Pediatrics and the Health Department director's letters to my motion. And so many people have spoken out in our community eloquently about this recently, including a lot of community leaders and business leaders. What I think about every day is, as I send my kids off to school, how aggravating and annoying it is for them to have to wear masks, how aggravating and annoying it is for us to sit here and have to wear masks. But I have to balance that with the total weight, the total moral weight they would carry if they ever ended up infecting somebody else at their school, their teacher who, and their classmates who might have vulnerable people living at home with them that we often don't think about. But despite all those inconveniences, what I think about most are the dedicated county employees who are out there on the front lines working. I think about our hospital workers who every day we read articles about the stress that they are under increasing hospitalizations because of people not following the guidance, not following the science, and not doing the morally responsible thing, which is to look out for one's neighbor and to support each other and do what you can to save a life. That to me, the weight of that compared to a convenience or inconvenience of wearing a mask or it being used as a political issue, I just find outrageous. And I think about so many people in our county that live with underlying medical conditions, so many seniors, so many teachers who have vulnerabilities and are afraid to go to work, so many kids who are unnecessarily being put in a position of trying to play politics at school instead of just going and trying to learn. And then all the progress that we've made. We've been through a lot. School board's been through a lot. We've been through a lot. To get to a point where we have high vaccination rates, to get to a point where people understand the importance of protecting each other, and where everyone in our community understands the importance and necessity of keeping in-person school going and keeping our economy and our businesses open and going. I mean, we simply have come too far. We simply know way more about this than we did at the beginning. And the idea that our schools now are front and center in a political war that is tearing communities apart and making the jobs of school principals and teachers and staff, school resource officers, health directors, so much more harder than it needs to be. We're supposed to be helping them and protecting them, not raising doubt, not saying on one hand it's their decision, but then on the other hand it's not filing lawsuits and spending our time in courts, but actually following the science and retreating to a fundamental belief that we care about each other. If I could prevent someone from catching the common cold from me, and I knew there were simple ways I could do it, I would do it, much less the flu or the pandemic. And so part of me is very sad today that we're even having to have this discussion in light of all the challenges that we face keeping staffing up, keeping people's health going, keeping our schools open, keeping people from suffering from mental health challenges, from being set off. I'm very sad today that we're even having to discuss something that's so fundamental, and that I hope and I know so many people in our community see as so fundamental. And so I'm sad to bring this forward today, but I'm also very happy that we live in a community that shares the statistics that I shared earlier, with high vaccination rates, belief in science, support of our public school and educators, support of our first responders, frontline healthcare workers, hospital staffers, and all those people who for over now 2 years, or ultimately 2 years, have been making sacrifices beyond our wildest dreams. And all we have to do is follow the guidance, the science, and mask up and try to help each other. And I'm proud that we've been doing that very successfully in Fairfax County, and I hope my colleagues will support this item.